So everything is in Turkish apart from my last name here. And first of all, I would like to welcome you all, and I would like to thank to the organizing committee and our colleague, Mr. Hassan, has adjusted all these topics because it's rather hard to make a planning for the program, and I also would like to thank him for this. And afterwards, Mr. Kemal, we talked with Mr. Kemal and we shared, and I'm representing the past, and he will be talking about the future. It seems as if the topic all belongs to me, but not like this. And in modern wise, even though it starts with Krapen, indeed, it just dates back to Hippocrates, and Hippocrates provides a biological definition for depression. And the first biological theory is that there are four fluids in the body, and they're all in balance. And when this is the case, the psychological condition of the person is in balance. And if the black bladder fluid is increased, then it goes for an depression. And the fluid which is excessive, then it needs to be taken out. And in the old times, in the Greek and Roman times, with Galenos, with the psychotherapy, it starts with, so in Pergamo, he comes from Pergamo, which is in our borders. So he is one of the important founders of the Western medicine. And then Hippocrates and Galenos, and also with the accumulation of the Greek information knowledge, and everything is lost in Europe, and within the framework of the Christian belief, starts believing in Christianity, and then people are considered to have a devil inside, and then they are killed, and then witch killing, and then they catch the people, and then the people try to understand whether the people have inside the devils or not, and they're tied, and then went into the water. But if they untie the ropes, then they would these people also considered to be having devils inside, and then they are still killed, and then they are also burned, and they're set on fire. And these people who were tortured perhaps are manic depressive, or they're hysteric, or they're manic depressive, so on and so forth. And in the time when this scientific approach was rejected with the old Greek civilization during the Middle Age, perhaps it caused many people to be tortured and had agony. And then we have the and then in the old Turks, there was shamanism belief, and with Kutlualuk belief, there are the doctors, physicians who treated with the drugs, and then there were also the people who tried to treat with certain ceremonies. And then we have the physicians, and as well as the shamans were respected people. And when we look into the Islam world, we said that while the West was in the Middle Age, and then in the Islam world, the scientists were translated the Greek and Roman manuscripts into Arabic, and then they used them. And the main belief was that these information knowledge belonged to humanity, and these are the pieces of the humanity, and then for that reason, it's an valuable information and knowledge that needs to be learned. So there was no discrimination among them. And even if Plato and many philosophers, Socrates, for example, and they saw them as if they're prophets, for example. And related to psychology, we see the studies, their influence in the studies, ilmun nefs, for example, the perspective of, and also The depression reasons were also examined, and there are certain cognitive therapies like today's therapies and Epictetus, Socratic philosophers, and once again, sophist philosophers and Stoa people who were in favor of Stoa, for example, and for that reason, it is said that the sadness, grief is not in ourselves; it is something that is created, and then in modern psychotherapy, approaches were present in that time, and these root back to the old ancient Greek and coming from those philosophers of the time. And in English, an interesting name. So it's Balki. He is the first medical psychologist to be that was considered, and also the psychological disorders were differentiated as two: psychosis and neurosis, and also the reciprocal inhibition was brought up by him. And once again, depression was differentiated or divided into two: psychological and physiological. And the psychological depression was treated with different matters, as well as the physiological depression was treated with different matters. And related to the approach of Balki, there is an detailed manuscript or detailed book that is available. And not only in the psychology field, Ibn Haytham, Al-Biruni, for example, the visual perception, the tactile perception, and sensitivity, illusions, and responses are also carried out in this field. And also, in terms of the psychotherapy studies, there are also the Islam scientists, and also Farabi, for example, carried out psychological and cognitive studies, and Ibn Tufayl, for example, Tabula rasa, the nature versus nurture. It talks about nature versus nurture, and it talks about or discusses the humanity, the human, and it also talks about the story of the Robinson Crusoe. So it's the original story of Robinson Crusoe. Mejusi, he carried out neuroanatomy, neurophysiology studies, and Ibn Sina as well. He also divided the spirit and the mental condition of the people as the plants and animals, as well as the human. And also he classified the mental disorders and diseases as related to the neuropsychiatry or the will. And also he defined the hallucination and also insomnia and the others. And in the Seljuks and in the Ottoman time, in the Islam world afterwards, there was an getting away from these concepts, and there are many reasons for this, of course. For example, Ghazali mentions about the philosophy that dealing with philosophy is a sin, and it was considered that it was going to take the people to bad things or this to sin. And Ibn Rushd also has got certain discussions about it. And Abbasis supported this period when the science was experiencing its golden period, and Abbasi really supported this time a lot. And in madrasas, that was a strict system. There was a strict systemization, and also the nature science did not have any place in that time. And there might be, of course, other reasons for this, but at the end of the day, those ancient manuscripts and books were read by the Western world. In the meanwhile, the Islam world goes into the Middle Age period, So it means as if while one gets out, the other one gets in. And in Selçuklu and Ottoman periods, so we see that the medical treatment applications and preventions or protection of the patients, and also we have the people who had psychological problems are to be approached with compassion, and also there was the treatment focus approach, and the humanitarian conditions were served or presented. And also in the meanwhile, in the Middle Age, there was very bad treatment of the people who had psychological problems. And the first Nuts House, Insane's House, was first established during the time of Fatih. And with the Renaissance, we have the Renaissance, and then during the Renaissance, then there comes up the medical approach, and instead of the supernatural explanations, there is the explanation of the medical explanations, and also there's the change of the authority, and also uh, there was the hunt for the witches, and instead of the hunt of the witches, now there are the explanations by the physicians provided. And for the first time, the psychology was established, and first the structuralism came along, and then in 1879, for the first time, Wilhelm Wundt establishes in Leipzig the first psychology laboratory, and also the response time was measured, and also Edward Titchener was the student of Wundt, and he for the first time uses the term for psychology, and also he provided the explanation regarding the insight method to get the information about oneself. And also William James establishes the first psychology laboratory, but his system was called the functionalism. It's not about the structure, but the functions. And then he's under the theory of evolution, and he talks about the fundamental function is to sustain the life as well as the functions. So when we look into our country, Turkey, we see that at the end of 19th century and the beginning of 20th century, we have Rashid Tassin, who lectured in Gülhane Medical Faculty, and he started, of course, educating with the army. And then Masar Osman was the founder of the Bakırköy mental health and nervous system diseases. And then we have Hasan Şükrü Aksel as well as Rasim Adasen. And the biological approach dominates, prevails during that time, and it's the beginning of the 1900s, and there are insane asylums during that time, and there are thousands of patients during that time in Europe during that time of enlightenment, and this is also the time period for the big hospitals. And then afterwards, during that time, it was explored that in those asylum of the insanes or insane asylums, 30 or 40% of them actually had psychotic symptoms like hallucination, and also paralysis general picture because of a certain microbe, because of a biological problem. And apart from that, deficiency of the vitamin were some cause certain causes. For example, in a ship voyage takes place, but the captain and the companions were in good condition. However, the others start behaving in an insane way. But then it's about all pellagra because of the deficiency of vitamin B, and this contributes to it actually accelerates the biological psychiatry. We have found the reasons such and such, so we would be able to find the reasons of the other problems. This creates a kind of big hope. And during that time, so Krapeni, one will look the things which were accepted to be diseases, for example, dementia, practice, and manic depressive, and then moral insanity, and the social psychology, uh, psychopathy. So these were considered to be these psychological problems. So Kripeni, if he would see now the certain situations, then he wouldn't consider these to be the disease. So when we consider these four aspects or points, these are really these are rather related to the structure of the brain. So in time, as the time passed by, this paradigm develops, and in after 1980, with the DSM, the prevailing paradigm, although said that we do not know the reasons for these psychiatric conditions, we diagnose them as per the symptoms, but just tacitly, when we ask the question why it happens so, it is just because of the genetic reasons, and it's about the functions and the structure of the brain, and accordingly the biological approach prevails, and the treatment choices are prominent. And also psychoanalysis is led by Freud, and Freud actually wants to establish a psychology, a science of psychology, and this is theory that was presented. And during that time, he benefits from certain information. And what are these? For example, among the scientists, popular scientists, the theory of evolution is newly presented, and also there is the physics of Newton, and of course this was combined, and accordingly the human psychology was elaborated, and then afterwards the behavioralism, and then we have the humanity, the trends. And Kraepelin, as I mentioned, he is the founder of the modern psychiatry, and until that time, the mental problems, diseases that were not known until then were explored, and afterwards there came along the vitamin treatments, and also the convulsive therapy of Meduna, and also creating certain fits for the patients, or Zerpine. This was it was tried as a first antipsychotic, and then chlorpromazine. It seems as if that before Christ or after Christ, because in the psychiatric disorders there was not much in hand, bromides or barbiturates and sedative agents, and their toxic thresholds are quite low. And for example, for a benzodiazepine, in order to show a toxicity effect, it would happen with a high dose intake, but there is a kind of cure, a limit cure. However, the barbiturates are steep, and then the toxicity, the range would be exceeded very easily, and then people would die. And phenobarbital, for example, toxication, perhaps not for the suicidal intention, perhaps to get good sleep, for example, Marilyn Monroe probably. And these were the prescribed agents, and it was mentioned and reported that she died because of the prescribed drugs. And there are many mortalities, and also hydrotherapies and insulin treatment, and also the lobotomy that was developed by Moniz from Portugal, and then it was applied onto 20,000 people, and agolmanosis, and then he was awarded the Nobel Medical Award, for example. And then there's the exploration of the chlorpromazine, and then it is just a coincidental and just pre-anesthesia, what could be given as a sedative for sedation, and it was a discovery afterwards, and it was tried to be founded whether it could be used for this schizophrenia patients. Then it started to be used for that aim for the psychiatric patients, and this is really dramatic. And the number of the people hospitalized, of course, as the facilities and the opportunities increased, we see that there's an increase in the number of the beds. And then in 1955, with the chlorpromazine discovery, we see that there's a decrease in the number of the beds, so that we can say that there's a kind of revolution that we can name it. So as you would remember that the mockingbird and the chlorpromazine is the name in the USA, and it stays in the word, and then the nurses take it into the injection and then inject it when there's a manic activity of the patient. In psychoanalysis, and then psychoanalysis, I have just mentioned about this. What Freud mentioned actually is that fundamentally what does the human do? If we just go into the roots, so the human tries to survive and to reproduce, and how this can be sustained with the sexual activity, and how the presence can be sustained, it would be with the aggression, and these are biological, and these both impulses are biological. So for that reason, it is about that why you are a psychiatrist, why you are here. These are all related to these two impulses. He says so. And the second thing is when he goes to Sharkun, and then he Sharkos works with hypnosis, and with the hypnotic convincing, and then the hysteria, now what we call the hysterial convulsion and hysterial paralysis. The artificial conditions can be provided, can be ensured with hypnosis, and this can be also retrieved. That let's say that I hypnose all the people here, and then I tell Selçuk, when I just make an like this, and then you would open the door. And when I do this, then Selçuk goes in, opens the door, and then I ask Selçuk why he opened the door, and then he says that I'm a bit depressed and I frustrated, and I wanted to open the door, or I don't know. Well, actually, it is about the command that I have already ordered to Selçuk. Whether Selçuk is aware of this, no. So for that reason, without the awareness and he says that certain forces can direct people. An obsessive patient, for example, just washes the hand very frustrated with an aggression, and then he also once again explains these conditions with the impulses as aggression and the sexuality, and then he says that the more the something is so frightening, then it would come up with a different kind of dress. For example, let's say that if the person has an fear of stage, what is the explanation in psychiatry? It is about the aggression, aggressive exhibition. And then afterwards, we have the Carl Jung, this collective out of conscious. And when it is about the collective field, it is more speculative. And there's the archetype concept. And Adler, Adler says that if if Freud would be in the follow Adler, then it would be much better. Actually, he followed Adler. Is very much Beck is very much influenced by Adler. It's the psycho-behavioral therapy is about him. So afterwards, there comes along the behaviorism. So what the behaviorism tells us that psychology should be an natural science, just like biology or chemistry, and what it has to be built on or has to depend on, it's observation. So what we can observe in this field, whatever is ongoing, and what the organism does, we are following all this and just examining the relation in between. Then it's possible that we can resolve the relation in between. And Alan Paulo discovers the classical conditioning and then forms the scientific basis. And this classical conditioning that was discovered in the animals during that time, it's quite assertive. And John Watson, who is against this, takes this and then applies this to the people, humans, and how a phobia could be created in a baby. Experimental has been exhibited by him, and all this human psychology was tried to be explained through this. So this thought. Thought and intention, wish, all these are not to be explained with us. And then comes along Skinner, and he is a radical behaviorist. And then he says that no, he says that it is possible that we can explain this with the conditioning. And he tries to explain how the languages learn with conditioning. And also from time to time, Noam Chomsky, sometimes we hear that he is already dead, but he says that it's not possible to learn language with conditioning, and there's an article very well known about it. And then the behaviorism has been shaken by this. And in the meanwhile, the behaviors sees the nature of the humans natural. Whatever is learned by the people, it comes out to be that way. But the psychology, the humanistic psychology, for the Freudian part, for the classical psychoanalysis, we say that it is about the aggression and as well as the sexuality. And even on the days when the Second World War steps were heard, this aggression that was named, the wish to be to extinguish or to abolish and to also to harm one. So he talks about these wishes, and then if he had seen the Second World War, I'm sure that he would have believed this better. So what is positive when we look into the history? The most positive thing is the theory. It's the humanitarian psychology, which is mentioned by Carl Rogers, and he was a theologist, and he says that everyone has accommodates a potential for being good, but because of the reasons as well as the history, the person cannot realize this potential. So for that reason, what the psychotherapy would do that will do for that person is to provide an ambient for this, and also truth, accuracy. And when you present this, then the person would find his own way. And then comes up the cognition theory or the cognitive theory, and where we so what the behaviorism does that this it is about that the behaviorism can also contain the cognition. So this is how it is said. So the knowledge can be processed, information can be processed. It's about the competency to use this information. So then this comes up with Albert Ellis in 1955, and also it is rather far earlier than the than the psychotherapy. But the cognition or cognitive approach, it does not work in the academics, and it is directly practical. And then it is applied in the clinical situations. And then with the cognitive psychology, it turns up to be an unity.
Here, actually, we say that there's nothing unsaid under the shine of the sun. Especially Alice, while developing this theory, he knows the psychoanalytics and he knows the behaviorism, and also he's keen on philosophy, Stoa thinking. And again, he sheds light on what they said. For example, Epictetus says that human beings are disturbed by not from themselves, but how they interpret the events. And during the Roman Empire times, the Phrygia state, which was Eskişehir in today's Anatolia, actually it's in the center of Anatolia as the cradle of the civilization, it is shown he was raised there. When we come to Turkey once again, after this cognitive theory, roughly to say all the evolutions in the world, we have seen this. And in Turkey, at Hacettepe University, Professor Leyla and Orhan Öztürk were the leaders. While Hacettepe University was being established by İhsan Doğramacı, they adopted German eco German type of education. However, German medicine is quite complex, it's quite specific, and in general terms, when we look at today's medicine world, many things that we suspect, like bioresonance or family sequencing, any interesting thing can be associated with the German medicine because it's quite specific and unique. We see this nowadays also. However, psychoanalytics emerged and developed in the U.S., and our professors were trained in the U.S. on these issues. In 1960 to 1963, Professor Leila was educated at New York Psychoanalytics Center, and she was telling that the aircraft stopped in New Zealand for some fuel refueling, and then the aircraft was going on to the US, etc. And Orhan Öztürk also was trained there, and then they returned to Turkey to establish Hacettepe Clinic. And in Turkey, when we are studying on any phenomenon, first you need to know its size. For example, in the press, in the media, we sometimes see some news as depression is increasing, panic disorder increasing in number, affecting many people, etc. But rather than saying increase or decrease, there are some rumors. Actually, we do not think that they're totally increasing. This is only possible to say through epidemiological studies. And in 1998, Turkey mental health study was conducted. We know the findings, and there is also a study which is said to be conducted, but we do not have the outcomes yet, which is conducted in combination with the World Health Organization and Hacettepe. Such studies are really crucial for me because when these studies are conducted by any medication company or institution or any university, it's really impossible because these are really big scale studies to be conducted by the healthcare organizations. We do not know what happens since 1998. Regarding the mental health care, we have some associations: Neuropsychiatry Association of Turkey, Turkish Association of Psychiatry, Behavioral Therapist Association, Pediatric Mental Health Association, etc. And these associations are also emerged and established during this time. And today, we until now, we have arrived this modern era, and Kemal Bey will take the floor for the current days and the future. And if you have any questions for the past of this field, we can receive the questions, or I can continue. Well, we looked at the past of psychoanalytics with Hakan. Now I will be gathering the criticisms regarding the current situation of psychiatry and from which perspectives we should handle the future of psychiatry. The main axis of this presentation will be from the Psychiatry Clinic of Marmara University Faculty of Medicine, and every week, once a week, we are reading books over the Zoom online. So a good part of being a lecturer at the university is to come together with young people, learning from them. While they are learning, they also contribute to your learning. Therefore, in the end, I will extend my thanks to them. But those book reading sessions contributed much to this presentation, which I can say honestly. Now, psychiatry in DSM-1 started with 106 diagnostic categories, and in DSM-2 there are 182. And there is a question. The human beings' emotions and behaviors are actually sliced into thinner slots and examined in a deeper manner? And are there any situations which are stigmatized and to be treated with medicine? Actually, our thresholds for diagnostics or lowering, or are these criteria being liberalized, or is there a spectra composing on everything that we put every finding into that basket? Am I going backward or forward? Can you show the first slide again? For many years, this is something criticized. DSM system. This is a checkbox psychiatry. You just check the boxes. When you see 3 or 5 symptoms, we make a diagnosis. This is the style of DSM. However, the medications are marketed in a more aggressive manner, which facilitates or accelerates the process. In Japan, for example, antidepressants and SRIs were not commonly prescribed 30 years ago. However, as a result of this aggressive marketing, the SRIs are now commonly used in also Japanese market. And serotonin or Gerald inhibitors are marketed for many things, such as premenstrual symptoms or migraine aches. And are these actually supporting the inflation of diagnostics or not? Media is also influential here in our country. For the last 5 or 6 years, we see an increase in the psychology TV series, and there are characters speaking in psychological terminology, and there are more people speaking with the same jargon recently. And we can also talk about the oppression imposed by the insurance companies in the US. And in this article, it says that there is no deflation or inflation in diagnostics. However, there are controversies regarding four diseases: ADHD, autism, eating disorders, and substance addiction are the four categories which bring about controversial discussions. And are we working with the false positives? Actually, we are prescribing those medications to the ones who are actually healthy. There are such questions always occurring. These are the two books that we read during our book reading sessions, and we discussed these. Alan Francis was very influential in the drafting of DSM-3, and for DSM-4 he was excluded. And years ago, I listened to him at the German Psychiatric Congress. In this book, generally 30 or 40 pages are allocated for the development of psychiatry and the role of Arabic people and Islam. And I rarely see such things. And in the historical development of psychiatry, he also gave a place to the developments in the Islamic world rather than the Western world. It was around 30 or 40 pages. Joel Paris, while I was working at McGill University, he was the head of the department. He is very productive. Every year he publishes one or two books. Now he is retired. In Phys and Fallacies in Psychiatry, he handles the popular things and the misperceptions and the matters which were popular ones like insulin coma therapy or vampire hysteria or dance hysteria, lobotomy, insulin coma therapy, which were once popular but faded away in time because neurasthenia is another example, neurasthenia, and which faded away in time, and the scientific basis were lost. And while saving normal, how to save the normal was the question. If we stigmatize everything as abnormal, every slice of life, every piece of emotion, when these are tagged as abnormal, where the position of normal be? Are we going to face a very small, tiny normal? And he discusses this in that book, and I will summarize their thoughts by adding some further studies and articles. There are some examples of this diagnostic expansion. For instance, depression with some under threshold symptoms. It is becoming diagnosed more, and the sadness or grief turns into depression. There is a book written by Alan Hartwig like Depression, Losing the Grief, and turning this into a depressive situation or tagging it as a depression is also mentioned or diagnosed as depression. And also the prolonged grief is also stigmatized. So bipolar disorder is also placed in its spectrum, and irritability, for example, is also seen as an indicator. Attention deficits. In the past, in traditional or conventional methods, it was treated, and the adaptation of children at school in classrooms was being improved. However, it's now treated under the title of ADHD, and it was quite considered as normal. However, anxiety or being shy, just being shy, was transformed into social anxiety nowadays. We were very hopeful about the neuroscience. It was in 1980s, and NIMH director Thomas Insel declared the age of brain. As a result of this age of brain, all the diseases were to be diagnosed, and new criteria with no log criteria, there was going to be a direct bridge between the neuroscience and neurologic diseases. However, the neuroscience information and knowledge got stuck at some point, and we needed to explain with new formula. And we haven't reached those new formula yet. How many dopamine receptors do we have currently? more than 5, the number
Evet,
of dopamine receptors
direkt artan oranlı dopamin
is
reseptörleri
increasing in number.
psikiyatri asistanlığı
And
bölümünde
during
çalışırken
our
ilk defa
residency, we only had
her
D1
şey
and
çok
D2,
basit
and everything was
deniliyordu.
easy then.
Düşünüyorduk
When
ki
D1 was blocked, this, and D2 was blocked, that.
dopamin reseptörleri
It was easy,
artıyor.
but the number of
Hatta
dopamine receptors increased, and the
abartı
life
olarak
became more difficult to explain.
söylüyordu.
And we saw that there was a more strict relation
E,
between these receptors.
Psikiyatri tedavileri etkili
And
yanıtlar doğrudan
psychiatric treatments are quite influential
bazıları
when they also save lives when they are used in a timely manner at the right doses. However, we still adopt a symptom based approach for the diagnosis, and maybe in the future, and we hope that the biological symptoms will be used again for the optimism that we saw during 1980s, and it would bring a more integrated
Evet,
diagnostic
temel
method.
problem
The main problem
teşhisi koymakta
in making a
gecikmemiz.
diagnosis, what is the basis
Checklist
that we
önemli.
rely on? Are we going to use the checklist method,
Yoksa
or
her DSM
for
testinin
each
kapsamını
DSM? At
öğrenmemiz
each
gerekiyor.
DSM, actually, there are really
Çok keyifli içerikler,
big
keyifli çıkarımlar da
debates.
geliyor.
There are
Bir
sometimes
şeye
arbitrary
bağlı
exclusions or
e,
inclusions. The
önemli olanı
arbitrary
checklist.
exclusion or inclusions would be prevented or
Şimdi
not for the future.
yaklaşık 35 yıl önce özellikle söylenen
35 years ago, as
duyarlılık
also said
temel
in this
amaçtı.
slide, the
Şimdi
sensitivity was the main
zayıf görme
objective.
kabiliyeti
However, a
önemli
weak
ve diagnoz
freedom is
teşhisi gerçekten
bigger
etkiliyor.
problem.
Yani tarif ettiğimiz
The
uygulamayı
diagnosis that
problem.
we do comply with the situation that we
Evet,
define or
checklistleri
do not
seviyorlar
comply. This is the
klinikada her
problem.
şeyi tanı
They
konusunda.
say checklist
Orada
medicine. We
hastanın
put some
kendisinde
ticks and we think that
çok
there
önemli
is a diagnosis. However, during this time, the self expression of the patient goes away, the subjectivity of the patient goes away. So, self perception of the person himself and where to locate oneself is totally disappearing. Unfortunately, this is a bureaucratic approach. In the patient and doctor relation, this becomes an instrumental approach. We only get what we want, and then we place our patient in a box and go away from the situation. We see the similarities and we do not see the differences. In the Turkish Psychiatry Journal, I published an article. Tajin Kuyofujo case was the title. An imam was delivering a speech to the public, and he was thinking that his stares disturbed people. He's not disturbed by people, however, he thinks that he was disturbing other people while staring at them, and he thought that people were hiding from him. And this is a social phobia. This is contrary to the social phobia and social shyness. But there is a syndrome called Taijun Kuyofusho syndrome in Japan, because it's very important to disturb the public order in Japan. So it is unacceptable by Japanese people to disturb any public order. Therefore, social anxiety can emerge like this in different manners. So there are also some other seriousness or some other severities of this Taijin-Kuyofuso syndrome. One theory says that, again, this was a discussion by Alan Francis, the mental disorders are increasing because our society is very stressed. Being normal is becoming more difficult. The modern world forces us to be abnormal. The modern world makes us insane, drives us crazy, or our tolerance to the differences is decreasing. So the difference is stigmatized quickly in this world. Or are we seeking for the excellence in this world? And in psychiatric diagnosis, there are not clear methods, therefore, our limits, our boundaries are ambiguous or not. When we look at bipolar spectrum, there are many things. And when we also say adult ADHD, we do not take into consideration the childhood story, and sometimes we make the diagnosis directly. For autism spectrum, we sometimes include Asperger's syndrome into this basket, and then there's a boost in the diagnosis. And anxious people, do we include them all? So this, are we relying too much on this chemical irregularity? Multiple personality disorder, for example. I don't know until now, since 1989, I graduated in 1989. It's been 36 years now. I have seen thousands of patients, and I have never seen a multiple personality disorder not filtered by any other specialist. Kazım or Selçuk, have you seen? The patient was was the patient was the patient sad beforehand about the diagnosis of multiple personality disorder by the other specialists or not? There are people, there are some colleagues who have seen such patients. A British psychiatrist do not see this disease. An American psychiatrist frequently sees because there are some popular understandings, and there's really a close convergence between the popularity and the diagnosis. There was a novel called titled Civil, and in the novel there is a character called a lady with 50 different personalities, and that novel affected the understanding of people. And the United States is very colorful and dynamic society, and it's very easy to uh, going towards that tendency when you see such a film or read such a novel. However, in a more conservative society like the Britain, like England, tendency is not that much. Therefore, regarding the diagnosis, the inspiration, actually these situations should be handled in a more technical manner, but the inspiration must be, there are some discussions that inspiration may be influenced by the hints, by the explanations of the therapist himself. And there are also some essays, articles. One is by Joel Farmas, The Rise and Fall of the Multipersonality Disorder, and this is the cover of the book I mentioned, the novel titled Sibyl. So if a therapist is prone to seeing that and provides feedback in that direction, such diagnoses are seen frequently, and the Sibit story is also fabricated. It was discussed so.
There is also an article about it. It's about the social media related to the dissociative identity disorder, and it plays an important role on this. There are many studies on this aspect. So ADHD has an expansion. It's as if it has exploded. So just like the forest fire, it expands. This diagnosis expands like the forest fire, and with which accurate diagnosis and with which accurate acts or activities we act, and the ADHD diagnosis, whether this is an overdiagnosis in the adults as well as in the children. So, and another one is about the childhood bipolar disorder, and it's considered irritability as a major the symptom, so that perhaps there is not such a situation. Is there anyone who is a child psychiatrist? I would like to hear, but this from you indeed. Just likewise, for example, this article tells us that the pediatric bipolar disorder rates are still lower than claimed. A re-examination of 8 epidemiological surveys used by an updated meta-analysis, and during the adolescent period, it would not essentially would go proceed for the adult bipolar. Nasentific, as mentioned by Nasentific, the well-known lines. Distinguished audience, this is English Turkish booth speaking. The speaker is citing out a poem. It is rather not to be translated, not being able to be translated. Sorry for the inconvenience. So sometimes we are the victims of the medicine. So we also have to pay attention to bipolar disease and Jewish angst is a well-known person about this bipolar disease, for example, and there are certain warnings by him as well. So just to keep in mind, just to give examples that there are certain discussions about, and autism has the same story. There are similar disputes and debates about it, and there is also a good book about it in Turkish. It's Autism Epidemics, or the Autism Matrix. And actually, some diagnoses are socially established, constructed. So for that reason, certain the people who need to benefit from social systems, social structures, this is how it takes place in autism and how it has become to be a kind of epidemic. And social phobia, of course, social phobia is not an embarrassment. So every form of embarrassment is considered to be a social phobia as a strategy of the medical companies, and especially in the Western world. For example, if there is a celebrity, when he says that I had a problem with such and such, then it becomes to be a social phobia. It's named to be social phobia, and there are certain articles which talks about this. And let's keep some of them. We have already mentioned about these. And grief, medicalization of grief, whether we're in that condition, we also have to pay attention. This is how it is worn. So grief, when it is a medical condition, then it is, so what happens that it is the most natural periods of a certain person, it becomes to be medicalized. So in the SM5 as well, this situation has been put forward clearly. And we give a message. So actually, we give the message that the person who has a grief should not has that grief, should not be sorrowful, should not be sad. So on the other side, how we can differentiate our profession from the pharmaceutical industry, and also the behavioral addictions is something as well. So regarding the reductionism, there's a problem. There is a good saying. The reductionism is more than all that is added up together. So if we if we would analyze the things in small parts, this would not be correct or accurate in terms of science. So what happens is that the thought, emotion, and behavior are the main three parts that we try to examine the person. However, if I get into interaction with you, something comes up, or if I interact with another person, it comes up another, there emerges another kind of culture or an interaction. We have to take into consideration the behavior in terms of society. For example, we have always talked about the childhood determinism, and there's a question mark about this, and the people who had traumas, and just a minority of them might have post-traumatic symptoms, and also the people in their childhood, if they were exposed to poverty, then there might come up with problems in their further ages, and these all need to be shown with further studies indeed. And let's speed up a bit. And what we need to do in the future psychiatry, there is a place of phenomenology, and this is how it has to be. So it means that the symptom, what it means for that person, and how that symptoms password should be resolved, should be solved. This should be significant. If I'm not mistaken, tomorrow or the following day, our colleague, Mr. Hayret, will be having a speech, or he will be having a presentation on phenomenology. So actually, the interpretation competence needs to be developed, because the two psychiatrists see some things, and the other one sees the hysteria, the other one sees the psychosis. These might be different. So the semiology as well as the phenomenology should gain more importance in our profession. So phenomenology is ensures us to build a relation with what has been experienced by the patient, and it would help us to understand what the patient tries to tell us, and it will also help us to establish a relation with the patient in a better position. And also, it will also help us to understand what the fundamental problem of the patient. It will help us in these aspects. So neuroscience, in neuroscience, it should be apart from the reductionism and further beyond the reductionism, and the psychiatric problems or disorders not related with the brain. It also includes the social environment, and systemic approach is much better, and we need more systemic approaches. And in neuroscience is not only neuroscience, it's also social neuroscience, because our brain is our social organ. It can also be present in the social atmosphere. So we have to pay attention to the dimension of neuroscience, and also the cultural processes uh, impact the architecture of the brain, and we have to take into consideration and deem on this more. And also, when we look into the human, the atmosphere, the surrounding should be taken into consideration, and we should be aware of this. If we do not pay attention to that, we would have some deficits in identification of the patients, and we need to have a perspective where social indicators are prominent, and we should also be able to see the unbalances, the inequalities in that person. This is a new study from Gaza that was carried out in Gaza, and it summarizes what we're talking about. The parts that were underlined, that are highlighted, It's about the people who lost their relatives and their uh, members of their family, the people who do not know which bomb would hit them in the morning, and the people who do not know what they're going to confront with in the war, and to which extent we can talk about their mental health of these people. It is not only about just diagnosing with anxiety, distress, or PTSD, whether this would be enough or not. So almost two-thirds of the population is exposed to the same problem, and they are aggrieved by this. And we have already talked about this. And in terms of neuroscience, we have got big expectations, great expectations, but now we have got limited knowledge, information, and we hope that in the upcoming time, with the clinical knowledge, the neuroscience would, in between, there would be a bridge between, and then we shall be able to reach somewhere. And the importance of culture and context are important in terms, they may play different roles in terms of expression of different symptoms, and some may be left behind or something may become prominent, and we have to pay attention. And in brain plasticity, the culture is really an important role. And for that reason, the systems thinking in psychiatry, the society, culture, social interactions, psychology, neurosciences are taken into consideration in this structure. And the vision for the future of psychiatry is that it would be about the progression in neuroscience, and also the neuroscience would approximate to more clinical knowledge, and phenomenology would be more subjective, and also we would pay close attention to the patient's lived experience and meaning and making. And absolutely, there's a need for cooperation and also the social context locally and globally would certainly be taken into consideration to understand the relations better. And to the extent possible, evidence-based mental health treatments should be opted, and this is also a requirement for this. And biopsychosocial model never has lost its validity, and it's more significant than the past, because we know that environmental conditions really create a lot of problem. And this is my team, my residents who have contributed to preparation of this presentation. And thank you very much for your listening.